Right now, though, in Washington, D.C., it's another big week in the health care debate. The Senate Health Committee could finish work on its health care overhaul. Its version would include a public option to compete against private insurance. And members of the Senate Finance Committee also will resume work on their own bill. That bipartisan effort so far does not include a government-run plan. Bloomberg's Peter Cook is standing by on the Hill with one of the key lawmakers in these talks. Peter?
Matt, thanks very much. I'm joined by Iowa Republican Charles Grassley. He's the ranking Republican on the Finance Committee. He's been part of these talks, bipartisan talks, trying to craft a health care compromise. You're back from the recess. First of all, welcome back. Thanks for the time. Appreciate you joining us.
Peter. Glad to be with you.
Give us your sense right now where the Finance Committee bill stands at this point. As you come back from this recess, a lot of debate over health care. Where is it?
Well, first of all, you know, our staffs during the recess were working hard, negotiating, trying to put together the less controversial things. I would say that the chances of bipartisan agreement are still being worked on. They probably hinge on the issue of play or pay, the issue of how you finance it, and the issue of a government-run health care plan, which I think would unfairly put the government in competition with the private health plans that people have. I held 12 town meetings in the state of Iowa during this recess because I wanted to get people's feelings on health care reform and the budget deficit. And let me tell you, people just want to talk about health care reform. I think that there's a lot of questions out there about what Congress is doing. I think that we in Congress need to explain to people, for instance, we're not adding $1 trillion to the $2 3/10 trillion we're already spending. We're restructuring the 16% of our economic pie that goes to health care, not adding $1 trillion to it. I think there's that misunderstanding. I think there's a misunderstanding about whether or not the federal government is going to take over health care entirely, you know, like in Canada. Few people want that. A lot of congressmen want that, but the vast majority of Congress do not want that, and our constituents don't want it. And I think if we had some time to explain to our constituents this very, very big problem that we're trying to deal with, that it would be better off.
Well, let's talk about a couple of the sticking points that you mentioned there. First of all, the price tag. Do you all have a better fix on what the Finance Committee legislation, still a work in progress, what the price tag's going to be? Is it going to be $1 trillion over 10 years, which, as you said, might actually constitute savings over the long term in terms of the federal budget?
Well, it has to be there or under, I think, in order to get a bipartisan agreement. I think it has to be there or under to be explainable to the people. And I think we have to, it's a very tough job, but you got to explain that's a restructuring of money within health care, not an addition of $1 trillion, because when people think that you're going to spend $1 trillion on health care and it's not a restructuring within the amount of money already being spent with this big budget deficit that the new president's put on the people, in addition to what Bush had put on the people and tripling the national debt, you know, it's a real concern and a real impediment to getting people's understanding that what we're doing is reasonable, and we ought to be able to speak to them in terms of it being a rational thing to do.
The Senate Health Committee is looking at the cost issue as well and how to pay for it. Their latest proposal asks employers to foot some of that bill. They have to provide coverage for their employees, particularly large businesses, or they have to, or they pay a penalty. What do you make of that? Is that not going to be part of the finance equation?
A tax on unemployment means less employees. At a time when we have high unemployment, we shouldn't be putting additional tax on employers, particularly small employers. The employers that provide...
Could they be exempted, sir?
Well, they could be exempted, but I understand that the Health Committee maybe only wants to exempt under 25 employees. You're going to put a lot of people out of business that hire a few more than 25 employees, and we ought to not be hurting the engine of employment in this country, which is small business.
What about the public option? You've been adamantly opposed to this from the start, yet it sounds like every other committee working on this legislation is crafting some sort of public option. Senator Schumer said over the weekend, he appeared with you in a program, listen, a public option is going to be part of the final plan.
If you want to argue more competition, I think the co-op approach would be a good thing. If they want
this compromise being discussed in the Finance
Committee. If they want to do it the way we've known co-ops for 150 years, but if you want to do it like Schumer wants to do it, Schumerize everything and have the federal government run everything, that's just going down the same road of a public option eventually. So here's what we're after. It's more of a political issue than it is a health issue. Because why is it not a health issue? Because we're going to provide insurance for people that don't have it. We're going to subsidize it so it's affordable, and for people that can't afford it but can't get it because of the discrimination based upon pre-existing conditions, we're going to have community rating and not have pre-existing conditions. So if everybody can have health insurance, what's this old story that Schumer's putting out about having a public option to compete? He says we need to keep the insurance companies honest. Well, if they're dishonest and if they're collusion, we can put them in jail for that. We ought to, that's why I say it's more of a political problem, because the people that are pushing it want Canadian-style health insurance. They want the government to run everything. I don't want the government in health insurance or in health care any more than they already are, and that's probably too much.
What about the effort to try and rein in cost savings here? We've already had Chairman Baucus of the committee in the White House meet with the drug industry, get concessions there. Now there's talk of concessions from the hospital industry as well. What can you tell us about that? $150 to $170 billion over 10 years. Does that sound doable to you?
If it is triggered in at the same time, hospitals are going to have less charity care, and they're going to have income coming in from the 50 million people that don't have health insurance. I think it's doable, and I'll let the Hospital Association and hospitals in the state of Iowa make a determination whether or not it's doable. But there is one thing that I'm keeping in the back of my mind every time, and that is hospitals are employers in rural America. They're the basis for economic development, getting people to come to the communities to create jobs, and it's also necessary for the delivery of health care in rural America, so we can't do anything to hurt hospitals in rural America.
But you think you're relatively confident this is going to be part of any sort of Finance Committee package? Is there a deal in the works?
Let's put it this way. Savings in Medicare is an absolute necessity because we're wasting a lot of money throughout the nation on Medicare and Medicaid. Let me put it this way. If people would practice medicine the way we do in Iowa and Nebraska, the Dakotas, Montana, the mountain states, do you know that we would cut down one-third on the health, one-third on the cost of Medicare, and we'd do it in a quality way, because obviously my state's fourth or fifth in deliver quality care, so it's not a case of quality, it's a case of elsewhere in the country they're wasting a heck of a lot of money.
Final question for you. I've asked you this a couple of times. How optimistic are you again that a bipartisan deal, something you can support, is signed by the president this year, or that you even get this done in the Senate by the August recess?
We might get it out of committee by the August recess. I don't know how you get something that's going to take a couple weeks of debate done between now and August the 8th. But I do believe that the president can get a bill. Now, you're asking me that today on July the 6th. Maybe on July the 13th, I'll have a whole different answer for you, because I'm in this as the only conservative at the table in a forum of 3 or 4 on Capitol Hill that only has a chance for a bipartisan agreement, and I want to bring some common sense to this debate.
All right, Senator Grassley, as always, we appreciate the time. Thanks for joining us here on Bloomberg. Matt, I'll send it back to you in New York.
All right, Peter, thanks very much.